I'm Sarah and welcome to Little Nutshells, a YouTube channel for new mamas exploring all things baby and toddler. And today we are going to learn about toddler teeth with a dentist. I'm honoured to have with me today Dr. Kiran Arora, a family dentist and surgeon with over 12 years experience and a mother of 3. Thank you for joining us today, Dr. Kiran.
Thank you, Sarah. So nice to be here.
Dr. Kiran is also a certified nutritional therapist, and she will be sharing with us today some of the best food to build strong and healthy teeth, so do stick around for that. But first, I recall when I was a new mother, the first question I had was, when should babies start brushing their teeth?
Thank you, Sarah. Actually, this is a really important question. It's something that I get asked pretty much all the time. When it comes to brushing your baby or your child's teeth, it's really as soon as the teeth come through. So you can expect this to happen around the age of 6 months, but everybody's different. It might be much later or much earlier. So essentially, around the time the teeth come through, that's a good time to start thinking about brushing their teeth.
And should we be using toothpaste?
Another very good question. So it really depends. If the teeth have come through after the age of 6 months, then yes, toothpaste is fine. Anytime before that, I would say their immune system or their stomachs aren't yet developed for it. If they haven't yet started solids, it's probably best not to start them with toothpaste. So brushing their teeth with just some water or just a dry brush would be fine.
Please tell me more about brushes.
So there's so many toothbrushes out there on the market. I would say try to stick to something that's easy for your child, your toddler, your baby to hold. So something with a grip. You sometimes see ones with a ring attached to it. I find that's quite helpful. You want to make sure it has a stopper so that it doesn't get lodged too far back in their mouth. Ideally soft bristles. Soft bristles would be much better. I don't know if you've seen these, but the silicone toothbrushes are doing really well at the moment. I like the fact that they don't need to be replaced as often, and you can even put them in the sterilizer, which is quite handy.
And what about fluoride? I've heard such mixed things.
The reason why we recommend fluoride is because fluoride helps to remineralize the teeth. The American Association of Pediatric Dentistry do recommend that you use a fluoride toothpaste right from the beginning, so from 6 months. And you're looking for a concentration around 1,000 parts per million after the age of 3. And before that, you would want to look for something slightly less. So fluoride's always been the controversial one, and if you did have an issue with using fluoride, I usually recommend my patients to look for something called hydroxyapatite. That has a similar function of remineralizing the teeth and protecting the teeth against cavities.
Okay. And what if they swallow it?
So this is where the amount of toothpaste you're applying on the toothbrush is really important. So we say a smear size amount. So a smear size amount can be thought of as the same size as a grain of rice. So we can expect the child to ingest the toothpaste. So we really don't want to be putting anything too much more than that.
Sure.
After the age of 3 years, we can put a bit more, so a pea-size amount. So limiting the amount that we're squeezing out of the tube is really important.
Great to know. And if our child refuses toothbrushing, what do we do?
I think, first of all, don't stress. It's going to happen. Most kids go through a phase where they just refuse to brush their teeth altogether. The reason why we get kids to brush their teeth is for 2 reasons. So the first reason is really just to establish a routine. And the second reason is to help strengthen the teeth and protect them against cavities. So in regards to establishing that routine, it's okay. You just keep saying that, okay, it's bedtime, so it's time to brush our teeth. If they don't want to brush their teeth, it's fine.
Okay.
Bring along their bunny. Okay, so bunny's going to sleep. Let's brush bunny's teeth. So they know, they associate brushing as part of that routine. And then when it comes to protecting their teeth against cavities, if they don't brush their teeth for a few nights, it's not the end of the world. But they are things that parents can consider doing that might help protect them. So when we brush teeth, we're trying to remove all the food particles and the acid buildup from the food that we've ingested throughout the day. So perhaps choosing something that's a bit more alkaline in nature, so something like a carrot stick or a cucumber stick if they're even younger. Just them physically chewing on that can help to remove all the buildup on the teeth and can help also promote an alkaline environment.
So at what age should we start taking our baby or toddler to see a dentist?
So the research all supports that the earlier you take your child to the dentist, the less likely they are to develop a phobia, and they're less likely going to need complicated treatment later on. So early is key. Don't expect much from the first dental visits. Most of the time it's really just establishing that connection, that bond, that trust between the child and the dentist. So most of the time it's going to be a little bit of an informal chat. So some parents bring their babies along when they're 6 months old, and that's great because then we get to know a little bit about mom and we can give mom some advice. But for children themselves, I would say from around the age of 2, they are more interested in what you're doing. They show more interest, but this really varies between child to child.
Okay. And are there any issues that we should be looking out for?
So first and foremost, we want to make sure that the child has at least 1 or 2 teeth by their first birthday. So if there's no teeth by their first birthday, this might prompt them to want to have a chat with their dentist and maybe see why that might be the case. Secondly, if they haven't got all their teeth by their 3rd birthday, that usually is a sign that maybe something is blocking them from coming through. So your dentist might want to take an x-ray, or they might want to take a bit more of a thorough history from the parents, from mom or dad. Sometimes if the teeth are coming through with a bit of a grayish tinge, this could indicate that they have some kind of mineral deficiency. It could be a nutritional deficiency. Again, a thorough history might reveal things that they can do differently to ensure that the adult teeth do come through in their optimal way. The other things parents can really look out for is, do the teeth have any white or brown spots? This could be a developmental issue with the tooth itself. And last but not least, cavities. Is there actually any cavities in their mouth?
How would we know?
With a cavity tends to appear as either a brown mark, you would see a hole in the tooth, you might notice some bad breath. Your child might even be complaining that food's getting stuck in their teeth. But ideally we want to catch it before it even gets to that point, and it usually reveals itself as a brown spot.
And as a dentist, what are the most common problems that you see?
You know, Sarah, one of the really sad things is dental decay is the most common disease worldwide in both children and adults. So we see a lot of this, and it's one of the most common reasons why a child might be put under general anesthetic. The decay is so bad that it can't be treated whilst they're awake. We have to put them to sleep, so the treatment's less traumatic. So it's a big issue. It's a shame because it's completely preventable, yet so unavoidable. And that might sound like a contradiction, but it is something that we weren't faced with many years ago. So our indigenous people, they didn't have dental cavities. So we know that this is a modern day issue, and it really comes down to the food that we're eating. And sugar is everywhere. And it's the sugar in our food and our refined carbohydrates that are really causing this mass epidemic.
Gosh, it's such a tough one because boy do toddlers love carbohydrates and sugar. So Dr. Kiran, you're also a certified nutritional therapist. What foods would you recommend us to give our children to help build strong and healthy teeth?
We want to go back to basics. We want to try and give our children foods in their most natural forms. So minimally processed, non-refined, whole grain. When people think of strong teeth, they immediately think calcium. And absolutely, yes, calcium is important, but calcium can do very little if it's not supported with vitamin D and K2, for example. And especially in somewhere like Singapore, where we feel we have ample sunlight, ample vitamin D, a lot of the population is actually still quite deficient. So you could be getting enough calcium, but it can't do its job if it doesn't have enough vitamin D and K2. Minerals are important. So this is like zinc, potassium, magnesium. All of these can be found in a whole food diet. So if you're eating proteins and vegetables and fruits, you will be getting all these essential minerals. But unfortunately, nowadays, children just like to eat food from a packet or snacks that are pre-prepared, possibly even a few years ago. So when it comes to what shall we actually feed our kids, we're essentially looking at minimally processed foods. So eating foods in its whole form, avoiding refined sugars, refined carbohydrates, sticking to the whole grains. Now, when it comes to children's snacks, preparing it at home makes a huge difference. And it doesn't need to be so fussy. Sometimes keeping it really simple and basic is better. So you can start giving them things like vegetable sticks, a hummus dip or a cheese dip. Dairy is particularly good at neutralizing bacteria, so cheese and yogurts are great. Nuts, seeds, if their diet allows. Fruits are fine as well, but in limited quantities. And just making your own cakes and biscuits at home and just knowing what ingredients are going inside.
Now that you've learned all about toddler teeth, you might also be interested in this video, Speech Delay in a Nutshell with Dr. Lisa Lim. Thank you so much for watching. Have a great day.